will the COVID-19 pandemic end? Perhaps we can get some answers through data-driven predictions by scientists. Researchers in Singapore estimate that the first wave of COVID-19 cases in the Philippines may end around May 12th. This means that by then, around 97% of all expected cases have already been identified. The researchers also say we will be able to identify all cases in the country by July 8. Researchers from the University of the Philippines have their own analysis. They believe Metro Manila will have around 140,000 to 550,000 COVID-19 cases by the end of April to June. Now, a huge number of that estimate will not be detected unless tested. UP researchers identified the hotspots as Quezon City, San Juan, and Pasig. Now, to tell us more about this, we have Professor Jomar Rabajante from the UP COVID-19 Pandemic Response Team. Professor, good morning. Thank you for joining us on New Day.
Good morning, Ria. Good morning to the televiewers.
Sir, Singapore researchers are saying that the first wave of COVID-19 cases could possibly end on May 19. Does your own research agree with their model?
Okay, actually, it's good, Ria, that you said first wave. Yeah, if we're not going to talk about possible second waves, it is possible that the elimination of the virus might happen, similar to the forecast of the Singapore researchers. However, I want to emphasize that this is for the first wave, and we should not be complacent because after that, many scenarios can still happen.
President Rodrigo Duterte himself said last week that the Filipinos should brace themselves for at least 2 more waves of infection. When and why would these occur?
Okay. So all of the scenarios that might happen after this first wave will depend on the interventions of the government and of the cooperation of the whole community, of the whole Filipino community. There can be many scenarios that might happen if we go back, let's say after lifting the ECQ, and we go back to our epidemic-friendly practices, we can expect a second wave or probably a little lower than the previous wave, but it still depends on our practices. However, if we are going to continue our measures, practicing good behavior, public etiquette, washing our hands, and more testing, we might expect a continuous decline or probably a second wave, but the peak is not that higher compared to the first one.
Professor, in your research published last April 13th, you noticed that at least now it takes a little longer for the number of cases to double from 3 days now to 6 days. Given the trends that we're seeing, do you still believe that Metro Manila will have up to 550,000 cases by the end of April to June?
Okay. This actually the worst case scenario if we didn't had the ECQ. So we might get up to this level. However, what we're seeing now is the effect of our ECQ. So that's actually good. However, we are telling the different LGUs that we still need to be prepared. And that's actually the goal of the enhanced community quarantine, for us to be prepared. We should not be complacent. So we are telling the different LGUs, if we need this number of ICUs, number of beds, hospital beds, we need to be prepared on that. We should not be complacent in the sense that we are seeing now less number, but we need to think for the future. So this is for future thinking. We hope that as modelers, we don't want the worst case scenario to happen. That's why we are helping the government to craft strategies. We give them recommendations.
Well, certainly your team has recommended the enforcement of general, enhanced, and even extreme community quarantines, depending, of course, on the probability of outbreaks in a given province or area. Can you say that you are satisfied with the president's decision to enforce the lockdown until May 15th?
Okay. Based on the recommendations of the UP COVID-19 Pandemics Response Team, we need to look at the outbreak threshold. This is the probability, the number of people that might initiate an outbreak, and we can compute for the probability of an outbreak from that. And the best case scenario is we want the number of cases to be lower than the outbreak threshold. If we cannot do that, we need to do more measure. For the NCR, we still have a lot of number of people, and I think it is helpful to extend up to May 15. But the thing here is we also need to plan what will happen after this. So we are actually crafting different strategies to help the different companies how to make their employees safe. We are talking to the LGUs how we can craft strategies to make the community lower their risk of COVID-19. So we need to make this period as a preparation to what will happen later. Because as modelers, we also want that this COVID-19 pandemic to end. We want this not to hamper our economic goals, especially for the people who need to do to work, and they want their socioeconomic status not really to go down and be of problem. So we want to help the different LGUs and the government units to craft strategies.
Yeah, preparation is absolutely key. Thank you so much for your time this morning, Professor Jomar Rabajante of the UP COVID-19 Pandemic Response Team.
Thank you, Ria.